On this video, I'm going to talk about recurrent yeast infections in women. I know most women have ever had a yeast infection, and it poses a lot of issues when it comes to hygiene, self-esteem, because of the pain, the itchy, the foul-smelling discharge, and it makes a woman very uncomfortable because of the itching. Sometimes it's treated and sometimes it goes away. Sometimes it even comes back. Now, understand this. I know most women have been told that yeast infections is as a result of a toilet infection. And that because of their anatomy, because of the squatting in the toilet, they expose their genitals to a lot of dust and germs. That is not true. We are the ones who feed the yeasts and lead to the overgrowth. Every woman has yeast, and yeast plays a key role in maintaining the pH of your vagina. But when the population of the yeasts increases, it leads to that overgrowth, and then they start to overwhelm you and cause you trouble. There are several ways through which we feed these yeasts. Number one is through hormonal contraceptives. So if you're using any form of hormonal contraceptive, you are likely to cause or to have recurrent yeast infections. Number two, sugar in all forms, including those people who take pineapples because they want their vagina to smell like pineapples or to smell like flowers. Any form of sugar that you consume, including fruits, including honey, it offers your yeast substrate, to feed on and multiply. So if you've had recurrent yeast infections, it's time that you need to consider dropping sugar in all forms. Number three, too much hygiene for women. What do I mean? Women don't understand that the vagina is a self-cleansing organ, just like the ears. You don't have to clean your vagina. You're supposed to wash the lips and the outside of the vagina, not inserting anything up there. But some ladies want to use soaps, others douching, others they use antiseptic wipes to wipe their genitals, which alter the pH of the genitals. So yeast infection is likely to overgrow and even overwhelm you when the pH is changed. Now, if you have conditions such as diabetes, HIV, cancer, these are conditions that lower your immunity and the body's ability to fight any infection. Therefore, for diabetes, which is reversible, you need to consider dropping all the sugar so that you can handle your diabetes. And then when the sugar level starts to normalize or stabilize, you'll not, the yeast will not overgrow. Then, for those of you who have those of you who air their panties inside the bathroom instead of airing them outside, you predispose yourself to a lot of infections because those panties do not dry well. They are not exposed to the sunlight, and therefore, if you wear them, you are likely to wear damp clothes. And this changes the pH, and this will lead to proliferation of the yeast infection. Something else, those of you who use steroids of different kinds, even men use steroids, particularly the anabolic steroids to build muscles, which is also very unhealthy. Using steroids for whatever reason, to broaden your hips, to increase your gluteus, to enlarge your boobs, steroids have been misused for the wrong purposes, such as dexamethasone. Steroids, they mess up with your kidneys and also end up messing up with your immunity, because your immunity is dependent on the kidneys, because the last activation of vitamin D from the sun, from the sun to the liver, and then from the sun to the skin and to the liver and then to the kidney. The final activation is done by the kidneys. So if you mess up with your kidneys using steroids, it will be difficult for you to synthesize that vitamin D, which is responsible for your immunity. All right. And then if you give your children steroids, children who are suffering from asthma, not even children alone, even adults, if you use steroids to manage your asthma, you are also killing your kidneys, and the same problem of low immunity is going to follow up. And therefore, when your immunity is impaired, all of these yeasts will start to grow. All right, I hope this helps.